recent research is shedding new light on blood pressure management in older adults, challenging some of the long-held beliefs about ideal targets. For decades, the standard goal has been 120/80, considered the perfect number for everyone. But emerging evidence suggests that this one-size-fits-all approach doesn't always apply to seniors. Older adults have unique physiology, and aiming for the same numbers as middle-aged adults may not always be necessary or beneficial. Understanding the nuances of blood pressure in later life can help seniors and caregivers make informed decisions and prioritize both health and quality of life. Why blood pressure targets can differ with age. As we age, several factors change the way our cardiovascular system works. Blood vessels stiffen naturally, a process called arteriosclerosis, making them less elastic than in younger years. Stiff arteries do not expand and contract as easily, which can affect how blood circulates throughout the body. In addition, baroreceptors, sensors in our blood vessels that detect pressure changes and help the body maintain stability, become less sensitive. Older adults may not experience the same rapid adjustments in heart rate and vascular tone that younger people do when standing up or changing posture. These factors, combined with age-related changes in kidney and liver function, can alter how medications work. All of these physiological changes mean that the ideal blood pressure for a senior might be slightly higher than the textbook 120/80, providing better circulation and stability without compromising cardiovascular health. Understanding the balance between numbers and function. Blood pressure is not just a number. It is a measure of how effectively blood is circulating to vital organs. For seniors, maintaining adequate blood flow is essential for the brain, heart, and kidneys. Research shows that overly aggressive lowering of blood pressure in older adults can sometimes lead to symptoms like dizziness, fatigue, and lightheadedness, particularly when standing. This is known as orthostatic hypotension, a common condition in older adults where blood pressure drops upon standing. By focusing on overall function, daily energy levels, and circulation, rather than just achieving a universal target number, seniors can optimize both safety and well-being. New research highlights for older adults. A recent study in the Journal of the American Medical Association followed over 15,000 adults aged 75 and older, analyzing real-world outcomes across a wide range of health profiles, including those with diabetes, prior strokes, and other common conditions. The study found that for many older adults, systolic blood pressure in the range of 130 to 140 was associated with the best combination of survival, quality of life, and reduced complications. Blood pressures below 120 were linked to higher rates of certain symptoms, while pressures above 150 increased the risk of heart-related events. This research emphasizes that moderate blood pressure targets can be more appropriate for seniors, balancing cardiovascular protection with overall functional health. Individualization, the key to safe blood pressure management. Each older adult is different, and so is their ideal blood pressure. Age, overall health, activity level, kidney function, and medical history all influence what target makes sense. For instance, a healthy 70-year-old might tolerate systolic pressure slightly above 140 without issue, while a senior with diabetes or kidney concerns may require a more controlled range to prevent complications. The principle of treating the person, not the number, is essential. Rather than rigidly pursuing 120/80, seniors and their healthcare providers can collaborate to identify a target that optimizes circulation, reduces symptoms, and maintains independence. The importance of checking for orthostatic changes. One of the most informative ways to assess blood pressure in seniors is through orthostatic testing, which measures blood pressure changes from lying down to standing. Significant drops can indicate that the blood pressure might be too low for daily activities, even if readings while sitting or lying down appear normal. Regularly checking blood pressure at home, including lying and standing measurements, can help seniors and caregivers identify trends and make safe adjustments with medical guidance. This practice promotes both confidence and safety in day-to-day life. Systolic versus diastolic considerations. In older adults, systolic pressure, the top number, tends to rise naturally due to arterial stiffening, while diastolic pressure, the bottom number, often stays stable or decreases. This widening of pulse pressure is common and generally expected. What is important is ensuring that diastolic pressure does not drop too low, ideally staying above 65 to 70, as low diastolic pressure can compromise blood flow to the heart and brain. Managing blood pressure with these nuances in mind allows for better circulation and a reduced risk of common age-related symptoms like fatigue, dizziness, and cognitive challenges. Cognitive health and blood pressure. Maintaining optimal brain perfusion is a key consideration for seniors. Evidence suggests that blood pressure that is too low in later life may reduce blood flow to the brain and could potentially contribute to subtle cognitive changes over time. Conversely, moderately controlled blood pressure within age-appropriate ranges supports healthy circulation and brain function. Balancing cardiovascular protection with adequate brain perfusion ensures that older adults maintain both mental clarity and physical well-being. Kidney function and blood pressure. Adequate blood pressure is essential for kidney function, which naturally declines with age. Too aggressive lowering can reduce kidney perfusion, while moderate, individualized targets help maintain proper filtration and organ health. Regular monitoring and collaboration with healthcare providers allow adjustments that protect both the heart and kidneys, creating a balanced approach that considers all organ systems. Practical blood pressure targets by age group. Recent research and clinical experience have shown that blood pressure targets for older adults should be individualized rather than following a rigid standard. Age, health status, and overall functional ability all influence what constitutes a safe and effective target. Adults aged 65 to 75 who are healthy, active, and without significant chronic conditions may benefit from systolic blood pressure in the range of 130 to 140, with diastolic between 70 and 85. This range tends to provide adequate blood flow to vital organs while still offering protection against long-term cardiovascular risks. Adults between 75 and 85, who often experience some natural stiffening of arteries and slower baroreceptor responses, can usually tolerate systolic readings slightly higher, around 135 to 145, while keeping the same diastolic range of 70 to 85. The goal here is to balance cardiovascular protection with functional stability, minimizing symptoms such as dizziness or fatigue that can occur with lower targets. Frail adults over 85 or those with reduced mobility or multiple chronic conditions may benefit from systolic pressures in the 140 to 150 range. For this group, maintaining stability, independence, and a reduced risk of dizziness or falls is more critical than strictly reaching traditional guideline numbers. Individuals with conditions such as diabetes, prior heart events, or kidney concerns may require slightly lower targets, often around 130 to 140 systolic, but these decisions should always be balanced with functional tolerance and symptom monitoring to avoid adverse effects from overly aggressive treatment. The underlying principle is that one number does not fit all. The ideal target is a combination of safe circulation, prevention of symptoms, and age-appropriate protection against cardiovascular events. Lifestyle approaches to support healthy blood pressure. While medications play a role in managing blood pressure, lifestyle adjustments are equally important, especially for older adults who may have multiple medications already. Small, sustainable changes can support cardiovascular health and help maintain blood pressure in a safe, comfortable range. Reducing sodium intake is a well-established strategy, as high salt consumption can raise blood pressure, while moderation can improve overall vascular health. Increasing intake of potassium-rich foods, such as leafy greens, bananas, and legumes, supports healthy vascular function and counterbalances sodium effects. Regular physical activity, even light or moderate exercise such as walking, swimming, or stretching routines, helps maintain heart and vascular health, improves circulation, and promotes energy levels and mental clarity. Managing stress through relaxation techniques, mindfulness, or gentle yoga can also influence blood pressure and overall cardiovascular function. Together, these lifestyle approaches complement medication, reduce the need for higher doses, and improve quality of life, creating a holistic approach to blood pressure management that considers both physical health and functional capacity. Monitoring and adjusting medication. When medications are required, gradual and careful adjustments are critical to maintaining safety and preventing symptoms such as dizziness, lightheadedness, fatigue, or confusion. Rather than making multiple changes at once, adjusting one medication at a time and closely monitoring both home blood pressure readings and symptoms allows for safe titration and minimizes the risk of side effects. Coordination with a healthcare provider ensures that medications are effective without compromising circulation, particularly to critical organs like the brain and kidneys. Regular reassessment is essential because optimal targets can shift with age, changes in health status, or new medications. Monitoring not only helps achieve target blood pressure ranges, but also ensures that seniors remain functional, active, and symptom-free. Open communication with healthcare providers allows adjustments to be made safely, with a focus on both blood pressure control and overall well-being. Key questions seniors can discuss with their doctor. Engaging proactively with healthcare providers empowers older adults to manage their blood pressure safely and effectively. Some essential questions to ask include whether current blood pressure targets are age-appropriate, whether orthostatic changes have been assessed, and how current medications may contribute to symptoms such as dizziness or fatigue. Seniors can bring home blood pressure logs, symptom notes, and results from standing versus lying measurements to provide a complete picture of their cardiovascular status. Open dialogue and shared decision-making ensure that treatment plans are tailored to the individual's health needs, lifestyle, and priorities. Discussing concerns openly can also help seniors understand when moderate blood pressure targets may be safer than aggressive lowering, ensuring that both safety and quality of life are prioritized in medical care. Case examples: applying individualized targets. Real-world examples illustrate the importance of individualizing blood pressure targets. One healthy 72-year-old may maintain a blood pressure around 136/82 with minimal medication, experience no symptoms, and remain fully active in daily life. For another 72-year-old with diabetes, prior heart disease, or mild kidney impairment, a slightly lower target may be appropriate, such as 130 to 135 systolic, but adjustments must be balanced carefully to avoid dizziness, fatigue, or other side effects. Frail adults over 85 often require systolic readings closer to 140 to 150 to support independence, prevent falls, and maintain functional stability, even if these numbers exceed traditional guideline targets. These examples highlight that age, health conditions, and functional ability guide target selection, emphasizing that a single universal number is not suitable for all older adults. Individualized targets prioritize both longevity and daily living, demonstrating that careful management tailored to the person yields the best outcomes. Home monitoring for accurate insights. Accurate monitoring of blood pressure at home is a cornerstone of effective management. Home readings provide a more representative picture than occasional office measurements, which can be influenced by stress, anxiety, or temporary factors. Seniors should measure blood pressure at consistent times each day, ideally morning and evening, and record each reading alongside any symptoms experienced. Over weeks or months, these logs reveal trends, highlight fluctuations, and inform healthcare providers of the most effective management strategies. Home monitoring helps avoid overtreatment or undertreatment and allows adjustments to medications or lifestyle factors based on real-world data, supporting both safety and comfort for older adults. The role of orthostatic testing. Orthostatic testing, which measures blood pressure changes from lying down to standing, provides crucial information for older adults. A drop in systolic pressure of more than 20 points or diastolic pressure of more than 10 points may indicate orthostatic hypotension, a condition that can cause dizziness or instability, even if average blood pressure readings appear acceptable. Identifying orthostatic changes allows healthcare providers to adjust medications, recommend positional strategies, and reduce the risk of symptoms that affect mobility and independence. Proactively assessing and addressing orthostatic changes can prevent complications and supports confidence and safety in daily activities. Balancing cognitive, cardiovascular, and kidney health. Blood pressure management in older adults involves more than protecting the heart. Maintaining adequate circulation to the brain supports cognitive function, preserving mental clarity and memory, while moderate pressures protect kidney function, ensuring proper filtration and overall metabolic balance. Aggressive lowering can sometimes compromise organ perfusion, whereas moderate, individualized targets optimize function while still offering cardiovascular protection. Balancing these factors emphasizes that blood pressure management is a multidimensional process in older adults, where functional health and quality of life are as important as numerical targets. Summary of key recommendations. For most adults over 75, systolic blood pressure in the 130 to 140 range is associated with optimal outcomes. Pressures below 120 may increase the risk of dizziness or reduced organ perfusion, while pressures above 150 increase cardiovascular risk. Adults aged 65 to 75 can target similar ranges but may tolerate slightly lower systolic readings if healthy and asymptomatic. Frail seniors often benefit from systolic pressures closer to 140 to 150 to maintain stability, prevent falls, and support independence. Diastolic pressures should generally remain above 65 to 70 to maintain adequate perfusion of the heart and brain. Orthostatic hypotension should be assessed regularly, as drops in blood pressure upon standing are often more impactful than moderately elevated resting pressures when it comes to safety, daily function, and quality of life. These guidelines underscore the importance of evaluating both numbers and functional outcomes rather than adhering strictly to one universal target. Advocating for yourself in blood pressure management, seniors can actively participate in their own health care by understanding their blood pressure and sharing observations with their providers. Keeping home logs, noting symptoms such as dizziness or fatigue, and checking for orthostatic changes provide valuable information that allows for individualized care plans. Asking questions about age-appropriate targets, discussing the potential effects of medications, and seeking guidance on lifestyle modifications empowers seniors to make informed decisions. Shared decision-making ensures that care plans are responsive to individual needs and evolving health status, supporting both safety and autonomy. Engaging in this process promotes confidence, independence, and overall well-being. Conclusion: prioritizing safety, function, and quality of life. The evolving research makes it clear that blood pressure targets for older adults should not be rigidly fixed at 120/80. Moderate pressures that are individualized based on age, health status, and functional tolerance provide a safer and more effective approach, supporting circulation, organ perfusion, cognitive function, and independence. By monitoring blood pressure at home, checking for orthostatic changes, and engaging in thoughtful discussions with healthcare providers, seniors can achieve a balance that prioritizes both longevity and quality of daily life. Treating the person, not just the number, ensures that management strategies enhance overall health, functional ability, and independence, allowing older adults to remain active, confident, and comfortable while maintaining cardiovascular health.